4. All right. What I'd love to do is first introduce Dr. Tara Doyle. So she is, oh my gosh, I was super impressed when I read through her. I mean, I knew she was an amazing practitioner and human being, but when I read through her bio, I'm even now more impressed. So just to give you a little introduction, Dr. Doyle is a holistic consultative care physician at Minnesota Personalized Medicine in Minneapolis. She's board certified in both family medicine and integrative medicine. She draws from best practices across medicine to incorporate into her care plans, helping patients leverage multiple modalities for healing and quality of life. Prior to joining Minnesota Personalized Medicine, she spent 15 years practicing primary care at Allina Health, and she has completed her undergraduate thesis at Yale University with laboratory research on cancer-causing genes and graduated cum laude with a Bachelor of Science in Biology. Her medical degrees from Northwestern University Feinberg School of Medicine. She was chief resident during her residency training in family medicine at Northwestern and was an inaugural member of the Academy of Integrative Health and Medicine's Integrative Medicine Fellowship, from which she graduated with honors. She's done additional training with the Institute for Functional Medicine, is certified in Dale Bredesen's RECODE protocol, which is geared towards dementia and Alzheimer's. She's a native of northern Minnesota. She lives in the Twin Cities with her family and her Boston Terrier. And so that's just a little bit of what Dr. Doyle has done. So but I have to say, personally, Dr. Doyle and I have been working together with client care, patient care for the last couple of years. And she is just probably one of the most humane humans that I know. So, I mean, in addition to those accolades and those awards that she has received over the years, I mean, she really comes to the table listening, very compassionate, has an awesome listening ear, is able to unravel these complex mysteries, and then also put together a practical plan for her clients. So she's listening to the patients and meeting them where they are, having them really identify what they need to do and helps to guide them there. So I am so honored to know Dr. Doyle and to be able to work alongside her with our mutual patients, and so happy that she's here today. So before we jump in, this is going to be nice and casual. So I'm going to ask a couple of questions. I'm sure Dr. Doyle will take that and really run. And so we can ask questions along the way. So as questions pop up for you, please put those in the chat section at the bottom. And so I'll navigate that and I'll be able to ask Dr. Doyle along the way, but you will also have opportunity to ask personally as well. But I just want to help you guys all understand kind of the difference between allopathic, conventional medicine, integrative medicine, functional medicine, and even personalized, like or preventive care medicine. So there's a big difference with all of these. But before we get started, just to make sure that with our questions, they're general, because we're not here for Dr. Doyle to treat us. So this isn't about any specific condition or symptom that you might be dealing with, but really just getting a good feel for what she does and what this includes. So with all of that, I'll take a breath and let Dr. Doyle take over. But I think the big question that I have, I think will be really important for everyone on the call, is just to understand these different modalities of medicine. So if you wouldn't mind sharing with us what that means, what all of these different types of medicine mean.
Well, thank you, Cindy. Thank you for inviting me tonight. So Cindy used a couple of different terms. The first was allopathic medicine, and this is what I think of as sort of the traditional big systems of medicine. So this is what you're going to get through your insurance-based, whether it's Mayo or Fairview or Health Partners or Allina. Those are some of the big players in this area when you go to their locations. Then I think of integrative medicine as a tent for some of the other things that Cindy talked about. So this is really drawing on allopathic medicine, but bringing in additional modalities. So it might be working with a functional nutritionist like Cindy. It might be adding on acupuncture, massage, energy work. So really trying to draw from a multitude of healing arts to leverage a patient's goals. And functional medicine is a subset of that, which is really a biochemical systems-based approach, looking at root causes of disease and trying to unearth driving causes for a person's current symptoms.
Yes, I want to dig into that more because when you say root cause, I love using the analogy of like a tree that is dying. I use that in functional nutrition because I think a lot of times conventionally, allopathically, if there's a symptom or a condition, instead of healing the roots, we tend to just put duct tape and try to bring those leaves back onto the tree, or we're painting the brown leaves green. So we cover up a lot of the symptoms instead of getting into the roots. So can you explain that a little bit more, Dr. Doyle?
Yeah, so I think looking at the roots are looking at things that are driving the symptomatology or illness. So instead of just trying to cover up the symptoms, trying to figure out, can we modify the things that are causing the symptoms? For the most part, you're not going to find just one thing as a root cause. So that sometimes there is one thing that you find, but usually you find multiple contributors, some of which you might be able to change and some of which you might not. And so it's really trying to, and this is where the personalized piece comes in for us in our practice. It's really trying to look at each person as an individual. What have been things that have happened throughout their life, starting even with their mother's health before they were born, environmental inputs, social inputs, stressors, physical inputs, things like medications. So looking at a full range of things from across the lifespan to figure out, if you have a rash today, what are some things that may have set up the environment for that rash to start? And then maybe something else was the thing that set it off.
So with that, in regards to symptoms, so a lot of times I hear my clients, and I'm not sure if you hear this too, it's like I'm tired, or I have a lot of pain, or I fall asleep at 7 o'clock, but that's normal, right? And so are these symptoms normal?
And I think, for the most part, people are really resilient and they're really amazing, and they really try to do the things in their lives that bring them joy. And so it's really common for me to hear people underplay their symptoms. And so, I'm fatigued, but I managed to get by, or I had this. And it's often once people start to improve that they say, gosh, now I realize how much that was impacting, or now I see all these other areas that it was showing up in, but that I just kept powering through, that I just kept trying to minimize or just trying to keep going. Because at the end of the day, when I talk to patients, what's most important is generally quality of life. And so I think every care plan and treatment plan needs to look at, what does quality of life mean for you? What are the things that bring you joy? And what are the things that we can do to help make sure that you have the physical, mental, and emotional energy to go out and have that joy?
Like if somebody wanted to engage with you and with functional medicine, what does it look like? What's the prep for the visit? What can they expect during their time with you?
So similar to the allopathic visit, we do a detailed history. Depends on the functional medicine provider, but generally our histories are going to look at a lot more than a checklist of symptoms and, past diagnoses, medications, and surgeries. So if you're doing a functional consult, it's going to be really helpful if you bring in other things that you think may be playing a role or may be influencing your health. Maybe you lived in a really moldy home at one point. That would be something that we would want to know. Maybe you lost a really close family member traumatically when you were a kid. That would be something that we want to know. So these things that can program the way that our nervous system, the way that our gut is responding to the environment around us, can really impact health later on. So in the initial visit, we go through what's called a timeline in functional medicine. And this starts with, again, your mom's pregnancy. And we look at different things that can have influenced your health throughout the years. And we generally focus by time frame. So, infancy, toddler years, grade school years. And we talk about, were you sick more than other kids? Did you get a lot of antibiotics? Did you have learning differences? Social challenges? Did you have fractures, sports injuries, concussions? We move through the college years, into adulthood. We talk about fertility. We talk about significant relationships. We talk about substances. We talk about exercise and diet. So really trying to find out all the things that are influencing people's health as they move through the life cycle.
Which, I mean, does that sound like your traditional doctor visits? No, and so really thinking about that, like your traditional doctor visits, when you go in because of possibly a symptom, or you're going in for your physical, you might get 15-20 minutes if you're lucky with that time with your doc. With you, Tara, or with another functional doctor, how long is that initial visit?
So it depends on where you go, but I would say the initial visits are usually a minimum of 60 to 90 minutes. At the clinic where I work, we generally average about 3 hours for the initial visit. So it's really trying to do a deep dive into both people's health, but also really understanding who they are as a person, what's important to them, because that helps us to really craft what we call an action plan or next steps. So that it's really personalized, but it's also something that's going to be doable and resonate with the person that we're working with.
So that brings up the next question. So here we have this really comprehensive questionnaire and questioning, try to identify a timeline and these potential triggers, the root causes. So then you mentioned action plan. So what would that entail? What do your patients typically walk away with?
Yeah, so patients will walk away with a printed next steps. Some might be further data gathering through laboratory testing. But if you've worked with Cindy, our philosophies in terms of the pillars that we're looking at are very similar to Cindy's. So, Cindy's not your run-of-the-mill nutritionist. She's going to ask you about your sleep. She's going to ask you about your exercise. She's going to ask you about your stress. And so we incorporate 5 foundational pieces as well. So we're looking at the physical piece. We're looking at movement. We're looking at breath. We're looking at all of these pieces that are going to be a part of the action plan. Some are more explicit and some are things that we're going to draw on later on. But when we're thinking about the action plan, we're looking at foundational pieces for health from multiple areas. So what are your social connections like? Who's your support system? How is that going to influence your health for better or maybe for worse? And what are things that we can do to support that?
So that brings up too, like with labs, how would that differ? Like what type of labs would you say? And I know it's going to differ from patient to patient, but as maybe a general rule, what types of labs would you be looking at, or functional medicine docs be looking at, that would differ from the conventional annual physical type labs?
Yeah, so we do draw on a lot of the conventional labs. And part of what's great about them is you can send them to insurance companies, and that's fantastic when it comes to the finances of medicine, right? And so we do draw on those as much as we can. And we use the regular reference ranges, and then sometimes we have what we call functional medicine ranges, or sort of ideal values. So maybe something is in the normal range. Well, the normal range for regular labs is anybody who is in the bell-shaped part of the bell curve, which is anybody who's between the 5th and the 95th percentile. So these are going to be a broad range of variation. For some specific labs, we say, well, we know that somebody in the 5th percentile and somebody in the 95th percentile aren't really going to look all that similar in terms of their health. And so sometimes we narrow that to what we call an ideal range. And that's sort of where we think people's health is best reflective. And take, for example, vitamin D. That's a great example of a lab where, the normal range might be 30, but studies show people whose vitamin D is higher than 30 tend to have better health outcomes. So we might interpret that through a different lens. And then we have specialized labs through generally what we call functional testing companies. These are often not covered by insurance. Their reference ranges are not quite as specific as some of the standardized labs. So when we're interpreting them, it's a little bit more of an art than a science, but you can really start to put a picture together. And if you start to see a bunch of things cluster in one area, that gives you a lot of information. If there's a little abnormal thing here or there, it might be that you ate something the day before that influenced the labs, might be that you are under a little bit extra stress. So you have to look at a broader picture with some of these functional labs, but they can be really helpful in helping to develop a full picture.
Right. And then that kind of brings a question too in regards to payments. Like with most functional medicine practices and with you at Minnesota Personalized Medicine, what does that look like?
So there's a wide variety of how people do this. But unfortunately, my belief is this is medicine everybody should have access to. And that's just not the current state of our healthcare system. So there are people who do functional medicine within big systems, and that was me for a long time. You do have limits to your visit, but you do get insurance reimbursement. A lot of functional medicine providers have gone outside insurance into out-of-network practices, which means that the patient pays for the visit up front, and generally these practices should be transparent about what they're charging. So either a per visit rate, an hourly rate, that type of thing. And then you can submit to your insurance company for out-of-network reimbursement. And the reason why most practices have gone this route is because the amount of time that it takes, and the amount of data gathering, and really it's time thinking. And generally medicine pays for time doing things like surgeries or procedures and not for time thinking. And so it's just been the reality of the system that if you want time to gather data, talk to a patient, and put together a good plan, insurance is not a very viable model.
So kind of talking to that, like what would be like a perfect type of patient for functional medicine, and what might be some case scenarios that might not be as pertinent for functional medicine?
So I think functional medicine is really good for quality of life. I think it's really good for chronic illnesses and disease. I think there are areas where allopathic medicine really shines. So if you're having a heart attack, please go to the emergency room and see your allopathic doctor, right? They are really good at acute life-saving medicine. It's what the system is set up to do. It's where the system shines. I have yet to cure cancer with herbs. I know people hear about this, but again, I can support chemotherapy side effects. But if you have cancer and there is a good allopathic treatment that's been researched for it, I think that's where you're going to get your best outcome. If you have an acute infection, again, antibiotics can be great in the right situations. And so I think for acute things, for life-threatening things, that's where our traditional systems are really excellent. I think for chronic illnesses, I think for things where traditional system kind of says, well, you have this thing, but we don't really know exactly what it is, or we don't really know exactly what we can do about it. Or also, maybe they say we don't have a treatment for it. Okay, that might be the case, but what can we do then to improve quality of life, to help you reach those goals for things that bring you joy? And I think that's where functional medicine can be really additive. And I think it's really helpful in helping to refine what can a really healthy lifestyle look like for somebody, even when you have a chronic disease. So let's say you have diabetes. Medications may be a part of that, but we also know that for many patients, if we do the right lifestyle things, we can fully control diabetes. And so functional medicine has a great role to play there.
Yeah, I was just gonna say that because I believe there's some folks out there who really want to do whatever they can for their health without medication. Now, and I know, so kind of speak to that. Like, is that something that you address, or you do cover all bases, right? So it's not just
Yep.
supplements and herbs, your medicine. So you do that element too.
Yep. So I prescribe medications regularly. I think they're an important piece of the puzzle when used appropriately. Part of what drew me to integrative and functional medicine after a couple of years in primary care was recognizing that the medications had limits. And so I could give somebody a medication for high blood pressure. I might even succeed in getting their high blood pressure to, what we call the goal level. But they didn't feel any different. Sometimes they felt a little bit worse because now they have a side effect, and then I might have another medication for the side effect. And so it just became this snowball, and it was focused on numbers and labs and check boxes and not people. And so I think combining, this is where medications can really be helpful, and they can be an important and necessary part of a care plan. And then using herbs, supplements, other lifestyle stuff, autonomic nervous system training, other healers. So I love having an acupuncturist on my team. I love having a chiropractor, a nutritionist, to really fill out the full healthcare plan for somebody.
And you just said something that made me think about, functional medicine being human, like focused versus, can you talk a little bit about that element? Because I think that is super important in regards to functional medicine. It's opposed to, not all, but it's a general rule, allopathic. Just understanding that the body is interconnected and we're humans.
We're human, the body is interconnected. The people around us, the things around us are going to influence our health. Two people with the exact same genes are going to end up with different medical stuff. And so that's all of the other things in one's life that's playing into it. So I think those are important pieces. I believe that people who have chosen to be in the healing professions really at their core believe in, are humane people. They really are caring people. I think, unfortunately, the system that many of us works in puts barriers between that and patients. And so one of the things that functional medicine has been intentional about doing as it has sort of developed as a field and structure is trying to minimize some of those barriers.
I'd love to open it up. I mean, I think this gave a really nice overview of the difference. Oh, wait, one more thing. Another big asset of Dr. Doyle is she is very skilled and passionate about preventative medicine. Can you talk a little bit about that and how that might differ from what we've been talking about so far?
Yeah. So if you look at allopathic medicine, everybody's gone to their doctor and you get your checklist. Did you get your vaccines? Have you had your mammogram, your colonoscopy? If you look at the Medicare requirements for preventive annual exam, there is no physical exam on it. So I've had many patients say, well, my doctor didn't even touch me. It's like, that is actually the template for that visit. I think when we think about preventive medicine from a functional medicine standpoint, it's not necessarily the check boxes. And we know that if a primary care doctor did all the check boxes that are recommended for preventive care with all of their patients every year, they would work 26 hours a day. So it's not even possible to do this well. But when we think about it from functional medicine standpoint, I'm thinking about, what's in your family history? What are the things that you're concerned about developing? What are the things that, when we look at your lifestyle, are you sleeping well? What's your nutrition like? Are you moving? Do you have social support? So what are some of the determinants of health and predictors of future health? We spend all of these resources on preventive medicine, and yet the data shows I can best predict your future health by your zip code. So that's not part of what doctors are talking about at these preventive medicine visits. But you can start to glean a lot when you really personalize things and look at, okay, what are some of the risk factors and how are we going to help you reach your healthcare goals and quality of life goals and have that joy for as long as we can.
Love that. So want to open it up. Sorry, I've been talking too much. So I want to open it up to everybody that's on the call to ask any questions that you may have for Dr. Doyle.
I have one thing that caught me. Just a term you used. I'm not even sure if I wrote it down right, Dr. Doyle, is autonomic nerve system training.
I'm so happy you asked that.
Ah.
Yeah,
Whatever it is, it sounds like I got it.
you did beautifully, and I would have phrased the question the exact same way a couple of years ago. So we are starting to really learn a lot about the interplay between the nervous system, the immune system, and psychology. I was recently at a talk by the Yale president, and he was talking about Yale's initiatives. And one of the things he said, which really, resonated with me in terms of what I do, is he said, we're working on funding medical science, and we think of the 20th century as germ theory medicine and about figuring out, germs and antibiotics and all the progress that we made on those front. And we think the 21st century is going to be microbiome medicine. So this is a lot of what Cindy does, a lot of what we do with functional medicine, and inflammation medicine. And so inflammation, we're starting to learn more and more about inflammation as a driver of other chronic diseases, from cancers to diabetes to cognitive things like Alzheimer's and MS. And so inflammation is driven by the interplay of almost every single system in our body. And the autonomic nervous system is one of the huge levers that influences that. So this is the part of our nervous system that is not generally being consciously controlled. It is automatic. This is what we think of as our fight or flight system, our rest and digest and reproduce system. And we're really starting to tap into and learn more about how do these systems work? How can we change or modify the patterns that we learn? And I think of it sort of how we were 100 years ago, where we knew about bacteria. We knew that diseases could spread through contact from one person to another. We hadn't discovered penicillin yet. And so, we know a little bit. There's a whole lot more to learn and to grow. And it's really exciting to be thinking about it and be curious about it and start to explore. We have ways that we can measure parts of these systems, and I think they will only improve with time. And we know that these systems get programmed by life events. So we know they get programmed by illnesses, by traumas, by things like concussions. And we also know that there are ways that we can reprogram them. And I think we'll be learning more and more about that. And that will be a really powerful lever in influencing inflammation and disease.
I'm
Like
curious. I know. Oh, go ahead. Go ahead, Anita.
I just was just to, because that last word was training. Like there's a possibility to train the nervous system to a certain degree, because to find another way to respond to negative stimuli.
Yeah, absolutely.
Yeah.
And there are traditions, so Ayurvedic medicine, traditional Chinese medicine, I think even allopathic medicine, although it has moved away from that, but there are healing traditions that go back thousands of years that are doing some of this retraining without really knowing exactly what they were doing. But meditation and breath work would be examples of that. Singing and humming influence the vagus nerve and can be examples of that. Cold and heat therapy are examples of that. So we see them in multiple cultures and traditions throughout the world over time. And now we're starting to figure out, how do we measure them? How do we influence them? And what are things that we can do to help to improve people's health and well-being using some of this knowledge?
Very exciting. Great.
Mm-hmm.
And would you be willing to share? Because I know in my own personal practice, I see a lot more folks that have dysfunctional autonomic nervous systems. So they do need that retraining. Have you seen an uptick in that recently? And if so, what would be potentially some of the drivers of creating more of a dysfunctional autonomic nervous system?
So I think I see a lot of it, and part of it is when you start to look for things, you start to see them,
That's true.
right? So as I have learned more about this and started to explore it, one of the things that has changed a little bit for our specific clinic in the last 2 years or so is, as we've explored this, there are 3 physicians at the clinic where I am. We have started to investigate tools that can help us to better evaluate this. So we have a autonomic nervous system evaluation tool in the clinic where we can measure and get a report on people's autonomic nervous systems. And then we also have some interventions, some of which are FDA approved prescriptions that we have used, and we can see somebody's autonomic nervous system response change over time. So this is something, again, it's fairly new for us, kind of in the grand scheme of things. It's been in the clinic about 18 months, I think. So we're really exploring and learning a lot and trying to collaborate with other clinics that are starting to do this work, one of which is the University of Minnesota. And a lot of this work is coming out of their psychology department. But I think it's fascinating and amazing work, and it's going to spill over and roll over into all areas of medicine.
So what makes somebody feel like if their autonomic nervous system is not functioning as well as it could? What are some of the common symptoms?
Yeah, so the autonomic nervous system is a little bit like the brake and the gas pedal in the car. And so when you're driving, often we don't think about this, but when we come to a stop sign, if you ask somebody what they do, they'll often say, well, I brake. And it's yes, but what do you do before you brake? You take your foot off the gas pedal. And then when you're ready to leave the stop sign, before you push the gas, you take your foot off of the brake. So there's a bit of a balance between, and it's simplifying things a lot, but 2 parts of our nervous system, parasympathetic and sympathetic. So the rest, digest, reproduce is one side. The fight or flight is the other side. One's not good, bad, better, worse. They're both needed for different points in our life. So what people might feel is if you are trying to brake and your foot's on the gas, you might feel like you can't slow down, you can't stop, you can't fall asleep. You have a lot of anxiety. Or if you're trying to press on the gas and your foot's still on the brake, you might feel like you can't get going, you're dragging, you can't get things done, you're foggy. And so it's both, do the systems work, and also are they in balance, and are they in the right place at the right time?
That's a great analogy. Other questions?
I don't think I have a question, but I just wanted to say that I have had the pleasure of working with Dr. Doyle. And I'm just going to say, compared to my other clinics, it's like magic. And it's hard to describe. I think it's your presence as well as what you say. It just increases your motivation. It just increases, I don't know, there's an investment, that you have in me, I'm just going to talk personally a little bit. And there's just something magic about that, to have a provider be beside you in that. And, you just want to follow through. And then, it's like magic too, of, telling me do this, and then we get the blood results, and it's like, wow, that's really cool. So I just wanted to say that.
Well, thank you. It's really an honor to be able to do the work that I'm so privileged to get to do. And it's so wonderful to work with people.
It's evident. Yeah, it's evident that you feel that way.
Thank you.
That's how I met you, Cindy.
Thank you. Well, and I think a lot of what you probably already experiencing, Sandy, especially in the functional medicine, functional nutrition world, is we are those healing folks that are so invested in helping our clients or our patients get to where they deserve to be in regards to how they feel, how they function, and where their health is. And so we're committed. We're committed to walk right alongside you to help you do that. And Dr. Doyle is like a perfect example of that. And so thank you for sharing that, Sandy, because that's exactly it. It's just not only a very proficient and skilled professional as a medical doctor, but also just as a human being who really understands humans. Other questions?
Oh, this just popped into my head. Are you taking new patients, Dr. Doyle?
I am, yes,
Oh,
absolutely.
good. Okay. I'm glad to hear
So
that.
how do we go? How would you go about
Oh,
that?
Oh, in the chat.
I
So,
see.
thank you for asking. So open
I
up your
see.
chat. So I did put a little link in there. So to connect with Dr. Tara Doyle is through Minnesota Personalized Medicine. Can you see that?
Yes, I bookmarked it, so we should be good to
Perfect.
go. Yeah.
Yep. So that's the best way, is just to connect with the clinic, and they can get you set up.
Carrie does new patient scheduling for us. And so she is a great resource and can kind of walk you through what that process looks like at our clinic. So, yeah.
Great.
And you're right down there. What's the park that's right next to you?
We're right next to Loring Park. So we're near the Walker on the other side of the park.
Know it well.
Wonderful.
So I want to say something that feels radical. That I heard you use the word, you want to live your life with joy. How often do you hear that these days? We know each other, a lot of us, from the Healthy Deviant, from Pelagia Simo. Do you know who she? Okay.
Yep.
So it's just more unusual to want and expect that from your life, to have a baseline of a joyful life, where you feel good, you're optimal, whatever your optimal is. And each one of us has a unique optimal, I'm sure, but that's something that is possible, is not talked about very much. So I heard you use that word like 2 or 3 times at the beginning when you were explaining, and it's almost like, really, could you use the J word?
So I will tell you, our clinic founder is Greg Plotnikoff. And it is something that we focus on. We have a sort of a weekly opening of the clinic, and we set an intention for the week with the clinic. This is something that's really important to him. So when I knew Greg from Allina, we've known each other for a long time. And when I was trying to figure out basically how to get out of Allina and practice medicine differently, I sat down and he said, "What would be your joyful job description?" And I think that's the best question. And in 20 years of medicine, nobody asked me that question. And so I try to kind of keep that paramount when I think about, what are people's goals, because it really resonated with me as, yeah, that's what I want to be doing. I want to be doing joyful work. I want to be doing work that fulfills me, but also work that allows me to really be in the zone where I feel like my gifts are being used. And I can really kind of sit in a zone where I feel like I can draw on the things that bring me joy. I think everybody has things that they love to do and things that they love to learn and things that love to explore. And we all kind of know where that place is, where you're learning about something or exploring something and you're just on a roll and it just feels great. And so I think when I think about, people talk about, oh, your job has to be your passion or you're this or you're that. I think what we're really trying to get is, how do you get into that zone of joy in your gifts? And that's what people are searching for.
Well, hooray.
And our clinic, yeah, works with Pilar as well. So we're very familiar with her and her work. And
All full circle. Yeah.
yeah, you'll find her referenced on our website too, if you look around.
Yeah.
Oh,
Other comments or questions that any of you have?
Well, Cindy, I have a very practical, basic question, and we're talking about cost. Because if it's not generally covered by insurance, maybe some of it is, some not, what is a ballpark figure? I mean, we talking thousands and thousands and thousands and thousands of dollars to do this? You know, how, over what period of time? Is this a lifelong thing? You know, all that kind of thing, because, you know, there is a limit.
There is a limit, and that's something we definitely struggle with as a clinic.
Yeah.
And Sandy can correct me if she feels like I'm not representing this accurately. So please feel empowered to do that. We try to be transparent about what we charge. The physicians at our clinic charge an hourly fee, and we have made an intentional decision to bill similar to lawyers. So we bill for the time that we spend looking at records with people, developing their plan. There are other services in the clinic, so lab services, supplement sales. I very intentionally structured the practice and my compensation differently than a lot of healthcare systems. So a lot of places get paid on the tests that you do and the labs that you run. And we have priced those at a very slight markup to our costs. So, you know, we're talking single digit percentages. Basically to cover the staff time of that administrative piece, because I don't want my compensation tied to if I order a $5,000 test to you. And sometimes I order $5,000 tests because I think that's the right thing to do. But whether it's $5,000 or $5, my compensation doesn't change. So that's one way in terms of how we're structured that is different than even many other functional medicine clinics. An initial intake at our clinic is generally going to run $1,500 to $2,000. So it is going to be usually at least 3 hours of physician time. Depending on your insurance, we usually start with a lot of insurance-based labs. Depending on your insurance, there may be coverage for that, or you might have a high deductible. So that piece is really hard for me to say. Functional labs generally run on the low end, $300 a test, and on the high end, about $1,500 a test.
Okay.
I would say many patients that work with us are going to end up having somewhere between 1 and 3 functional lab tests. And so I think, you know, if you look at like a less complex plan and set of visits with us, over that first year or so, you might be in the $3,000 to $4,000 range. Some of our more complex patients are going to be much more than that. And it's something that I mean, the finances of medicine are kind of ugly for everybody involved, right? We struggle with it. We struggle with knowing that it's a huge financial commitment to come to our clinic, and how much health impacts people's finances, both in our clinic and outside of our clinic. And so it's something that I think is unfortunate, but the reality is that's the way that we're structured.
Yeah.
And so we try to be transparent about it. And I also try to keep in mind, like if you go to Alina for $407, you can have a 25-minute visit. That's what they charge, at least in 2021 for a 25-minute visit. My current hourly rate is $495. You get 60 minutes for that. So I think we're competitive, but we're doing things, you know, you can have an MRI for $2,000, or you can have 2 hours with me. And people can decide, you know, sort of in terms of their values, how they're going to weigh those out. But I get at the end of the day, $2,000 is still a significant amount of money.
I appreciate the honesty and the transparency, because you don't often get that. So, thank you.
And you mentioned that your clinic, Minnesota Personalized Medicine, does bill insurance to see if there is some out-of-pocket coverage, correct?
So we do not bill insurance directly. We do give patients, we are contracted with an app called Reimbursify. So patients can upload their statements to Reimbursify, and we cover the first 5 submissions through Reimbursify. So they can use the app to submit to their insurance. They can submit on their own to their insurance. We also, our lab contracts directly with Quest. So Quest is in network at most major health insurers. So to the extent that we can leverage Quest labs, we do that, and Quest will then bill your insurance directly for the lab testing.
And then if there's health savings accounts or flex spending accounts.
Yep. So health savings accounts, flex spending accounts can be used for visits. They can also be used for more things. So they can be used for supplements. They can be used for the functional lab. So they can be used for things that insurance won't cover.
Yeah, so I think like what Dr. Doyle was saying too, it's not necessarily for everyone, but I mean, I think if you have a chronic condition and you don't feel it's being managed, or you don't feel like you're getting to the root of what you might be dealing with, that's really where functional medicine shines, is really helping you get to the bottom of what might be preventing you from having full joy in life and enjoying every moment to its fullest.
In my ideal world, everybody would have this kind of healthcare at an affordable price for them all the time. But you know, that's not the reality.
Day.
My dream world.
Yeah.
Well, I'll just say that I think I saw you once in a year, and so that initial cost was, in my mind, I can afford it, but I given what I got, it was just, I mean, again, like I wanted to say, it was like magic. And I think I saw you probably a month or 2 after I had my first Medicare wellness, and it devastated me, the wellness check. I just came out thinking, this is my precious life, and I'm just a goner, just because there was just not a fit with, with having that with my other clinic, kind of thing. I just felt like something changed when I got into the Medicare world. And that's what sort of inspired me to look you up. I actually have been referring to your clinic for a long time in my position, and so on. And so I just thought, well, I'm just going to take the plunge. And it was, I can't speak higher about it, and all of the labs that I've had have been paid for through insurance. I don't think we've done many functional ones, but yeah. And yeah, that's all I'll say.
Thank you for sharing that, Sandy.
Well,
Great questions. So this was a full session with Dr. Doyle, really trying to understand. Do you feel a little more comfortable about the difference between the different types of medicine that are out there and what functional medicine is all about? Good, then our job is done, Dr. Doyle. So you have the link in your chat if you do want to reach out and connect with Dr. Doyle outside of our session today. Otherwise, I will be posting the link for the video, and I'll also put the link there too, so that in case you did lose it from today's chat, I'll put it in the chat in Healthy, so you'll get that through the fasting membership. And I thank you guys all for coming tonight. We both really appreciate it. And thank you, Dr. Doyle, for taking your time tonight to share your.
You're welcome. I'm so glad everybody came. I love seeing people who are curious about these different kinds of healthcare and healing. So thank you all for coming.
Thank you.
Thank you.
Have a wonderful night, everyone.
You too.
Enjoy the rest of your evening.
Thank you.
Thank you.
Bye.